Welcome. My name is Vicky Khoury, a Pediatric Infectious Diseases Fellow at Stanford. My project is titled Beyond the Operative Room, Gastrointestinal Surgical Site Infections, or SSIs, in the pediatric population. SSIs, the costliest hospital-acquired infections, are monitored through the National Healthcare Safety Network using the Standardized Infection Ratio SIR. SIR over 1 indicates more observed infections than expected. The SIR is based on risk factor models not well validated in pediatric populations. At our quaternary multi-specialty pediatric referral center, our infection prevention and control team found a consistent high SSI-SIR for gastrointestinal procedures compared to other surgeries. This data outlines the yearly SSI-SIR from 5 common gastrointestinal procedures, with up to 600 such surgeries performed annually. While there's been an uptick since 2019, it's worth considering that our enhanced surveillance may partly explain this rise. However, our data mirrors findings at other institutions. A recent study across 280 U.S. hospitals caring for pediatric populations also noted elevated SSI-SIR from 3 gastrointestinal procedures. There are evidence-based guidelines within preoperative, intraoperative, and postoperative phases. These interventions have been shown to reduce SSIs in many pediatric procedures, but their impact on GI SSIs is not as obvious. There may be additional opportunities for improvement that are not being addressed through the current bundles. For example, nutritional status or social determinants of health that are addressable, such as language concordant care. The recent Shea Research Network survey revealed that most facilities do not assess health disparities in hospital-acquired infection rates. There exists a wide gap in understanding pediatric gastrointestinal SSIs. We may not be accurately capturing risk factors currently available in pediatric SIR models, which may contribute to higher than expected SSI rates. Alternatively, we may be relying on prevention bundles developed for adult patients. With limited evidence for pediatric-specific risk factors and interventions, we have an opportunity to develop new approaches to SSI prevention in children. Our overarching goal is to reduce GI SSIs. By improving our understanding of modifiable and non-modifiable risk factors, we will be able to gain a better understanding of how to improve risk adjustment models for SIR determination and identify novel interventions that can enhance current prevention bundles. This retrospective matched case control study will analyze pediatric patients who underwent gastrointestinal procedures at our institution from 2019 onwards. We'll compare those who developed SSIs to those who did not, excluding repeat procedures and transplant recipients. Using a 2-to-1 age-matched controlled case ratio, we aim to achieve precision while managing project timelines. We've identified 100 patients meeting NHSN reportable SSI with an anticipated sample size of 300 patients. In our first aim, in red, we'll identify potential risk factors among children undergoing gastrointestinal surgeries who develop SSIs compared to those who do not. In the second aim, in blue, we'll compare post-operative outcomes between these groups. We'll examine patient procedural risk factors and key bundle elements, as well as novel areas such as impact of race, ethnicity, written and spoken language, and other areas of social determinants of health to assess potential disparities that are addressable. For the analysis, we will use conditional logistic regression models, and with our sample size, clinical significance will be achieved by detecting an odds ratio of 2.5 with 80% power. We have several pitfalls. Firstly, since this is a single-center study, population characteristics are specific to our institution. We plan on performing a multi-institutional follow-up study. Secondly, we may miss potential relevant risk factors for risk identification. However, we are exploring novel areas. Thirdly, we are relying on chart review and documentation may be incomplete. Beyond conducting a multi-institutional study, we plan to evaluate the impact of updated risk models on 2 standard metrics used nationally. We plan to close the gap and better understand if the SIR models adequately captures risk factors or whether refinements are needed. Last, preventing SSIs in addition to health equity and social justice has been Shea's top priorities. The generous award will allow this project to meet financial costs. I am supported by a remarkable group of mentors spanning in infection prevention control to surgery. I'm humbled by this wonderful opportunity and look forward to seeing you all at Shea. Thank you.